Doesn't matter what level of sick or well you are, these techniques are critically important for managing anxiety. And anxiety is also not good or bad. It's a signal that's telling us to pay attention to something in the environment, right? If we judge the anxiety and say, oh, that's bad, I hate that feeling, then we're not actually taking the time to feel it and understand by feeling it what it's trying to signal to us. So if we understand that we can feel it safely and process it, then usually within 30 to 60 seconds, what is causing that comes to us, and the solution therefore also comes to us, which is, okay, I'm thinking about something I can't control. Let's redirect my attention to something I can. Let's take a deep breath. Let's go for a walk. Let's go hug a friend or get a hug from a friend. The solution becomes apparent. Let's solve X problem that is preventing me from feeling safe and in control. Of course, some people do benefit from medication, whether it's plant medicines or natural or standard prescription Western medications, depending on where you are at on the spectrum. But the beauty of these techniques is they work for literally every human being because we have so much more in common than we do different. And diagnoses are not for you, is not for the patient. It's for us as doctors and clinicians to communicate patterns of illness with each other so that we can figure out how to treat things better. If we tell a person that they have depression or PTSD or whatever illness, especially with mental illness, and the common public understanding is that that illness is a lifelong illness that will never get better or that most people never get better from, we are literally dooming people to identifying with that. It starts to become their identity. But that's not the goal. That means that their treatments are going to work less well, right? Because they think they're sick forever. If I'm taught by my doctor who I respect that I'm sick forever because they thought they should tell me my diagnosis, then of course my treatments aren't going to work as well, right? So then you will have to then spend all this time fixing that, which is what we call illness identity disorder, which is the most common thing that I treat in my practice, other than people who've had really challenging psychedelic trips. Take that and effectively separate identity from what they're actually experiencing so that they know they're not the same.